my name's Caitlin, and today we're going to be talking about compartment syndrome. Compartment syndrome is the most serious complication of casting and splinting. It occurs when increased pressure within a confined space compromises blood flow and tissue perfusion. Ischemia and potentially irreversible damage to the soft tissues within that space can occur within a few hours if action's not taken. It is very, very important to notice this early to save the limb, essentially. Compartment syndrome usually results from bleeding or swelling after an injury. The pressure impedes the flow of blood to and from the affected tissues. Numerous mechanisms can cause increased pressure, and these include traumatic injury, internal bleeding, edema, broken bones, burns, overly tight bandaging, surgical repair of blood vessels, blood clots, vigorous exercise, use of anabolic steroids, abdominal surgery, sepsis and other infections, abdominal bleeding, and pelvic fracture. Compartment syndrome can occur in the arms, hands, feet, legs, or abdomen. So with compartment syndrome, some of the clinical manifestations that you're going to see with this syndrome are decreased sensation, numbness or tingling, or weakness of the affected area, paleness of the skin, severe pain, and the pain isn't going to go away after you take pain medication, or if you say you have the cast on your leg and you elevate your leg at heart level, that pain isn't going to go away when you elevate your leg. You're going to see swelling or inability to move the affected limb, pulselessness, paresthesia, and complete paralysis may be seen. These are typically found in the later stages of compartment syndrome. So next, the pathophysiologic changes of increased compartment pressure are sometimes referred to as the ischemic edema cycle. The capillaries within the muscles dilate, which raises arterial and venous pressure. Capillaries become more permeable because of the release of histamine by the ischemic muscle tissue, and venous drainage decreases. As a result of this, plasma proteins leak into the interstitial fluid space, and then that's when the swelling happens. Swelling increases the pressure on nerve endings, and that swelling on the nerve endings is what causes the severe pain. And the pain that the patient is going to experience isn't going to feel like the pain from their broken leg. It's not going to feel like the pain from that injury. It will feel greater than expected for the nature of the injury. Ways to diagnose compartment syndrome. The diagnosis of compartment syndrome is based on clinical suspicion, assessment of the 6 P's, which the 6 P's are pain, pressure, paralysis, paresthesia, pallor, and pulselessness. The earliest indicators of compartment syndrome are pain that seems out of proportion to the underlying injury, and pain of other muscles in the immobilized limb on passive stretching. The patient may state that the cast or splint or brace or whatever they may have on their limb, the patient might state that it's too tight, or they may say it's too tight. The provider should be notified immediately. It is very important to notify your provider immediately when you see these symptoms, because in order to save your limb, you need to do this ASAP, or you could potentially lose your limb. A delay in the diagnosis increases the risk of failed treatment, poor outcomes, and additional operations. Complications that can result from compartment syndrome include permanent nerve damage, loss of function of your limb, possible amputation, infection, contracture, myoglobinuric renal failure. It is the job of the nurse to make sure that the patient is educated on compartment syndrome. If you have a patient go out of your office in a cast and they've never had a cast before, you need to let them know, hey, look for these signs. Tell them, if it's pain and it doesn't feel like your broken arm pain or your broken leg pain, you need to tell me that. If you feel tighter pressure in your cast, you need to let us know. If you feel numbness, tingling, if your toes turn white, if you can't feel the pulse in your foot, these are signs that you need to report to your provider as soon as possible. But yeah, it's the nurse's job to teach the patient that. The nurse should teach the patient these 6 P's and report them as soon as possible. As we talked about before, manifestations of compartment syndrome include tingling, numbness, worsening pain, edema, pain on passive movement, and unequal or undetectable pulses. So this brings me to our lovely patient here, and her name is Miss Left Leg. So Miss Left Leg was recently injured and has her leg in a soft cast, as you can see here. Miss Left Leg has reported to our emergency room with complaints of tingling, numbness, and pain when she stretches her leg. Upon assessment of her leg and foot, we have also gathered that her toes are cool to touch, there is pallor, edema is present, and the pulse in her foot is undetectable. So, a question from our audience is, at this point, what should be the nurse's next action? Very good question. So first of all, we need to notify our provider ASAP. The doctor needs to get in here and assess this patient himself, and we need to prepare for a fasciotomy. So here I am, the nurse. There is no palpable pulse. You can clearly see that she has pallor in her foot and leg here. The soft cast does appear too tight. So after we contact the provider, the next thing we need to do is to loosen up that bandage. That bandage needs to come off of there. So then the nurse would help prepare for the fasciotomy. Fasciotomy is where the surgeon is going to take a scalpel and just slice right down the side of the patient's leg, and he's going to create that opening into the fascia, into the tissues of the leg. This can be necessary to prevent losing the limb. The next step after a fasciotomy, if the fasciotomy doesn't help relieve that pressure, and if there's not too much infection in there, or if there is too much infection in the leg, then amputation is the next go-to there. The nurse should monitor the patient for comfort, impaired mobility, and decreased sensory perception of the affected extremity by following the assessment of the 6 P's. If the patient is prepared for a fasciotomy and it is determined that too much damage has been done and the limb cannot be saved, amputation is the next in line. In the event that amputation is needed, the nurse is there for the patient to discuss any feelings or concerns that the patient might have. And that concludes compartment syndrome. Always remember to notify the provider ASAP. Thank you.